only mode.
Hello, and welcome to today's webinar, Pet Wellness, Components of a Comprehensive Lifetime Care Plan. My name is Erin Elliott, and I'm the Senior Director of Campus Engagement for the University of Minnesota Alumni Association. We've had nearly 200 alumni and friends register for this webinar, and I'm absolutely thrilled that so many of you are sharing your time with us today. Today's webinar is part of a new free series being offered by the University of Minnesota Alumni Association, where we're having conversations with experts about career, life, and learning topics. The webinar is being recorded and will be viewable afterwards at minnesotaalumni.org/alumni webinar series. Just give us a few business days to post it to our website. We'll also be sending a reminder email. We're offering one more career webinar at the end of April. All of our webinars will be posted as they occur for on-demand viewing off of our website, so you can access all of our recorded webinars wherever you like, whenever you'd like. Before we get started, I'd like to go over a few items so you know how to participate in today's event. If you've joined the presentation listening using your computer system by default, if you prefer to listen over your telephone, just select telephone on the audio pane of your GoToWebinar panel and the dial-in information will be displayed. If you experience any audio difficulties while listening via your computer speakers, this can be caused by having multiple software applications open, which can cause your computer's bandwidth and affect your network performance. Feel free to close any unnecessary applications on your computer. Questions are welcome, and you may submit them at any time. We want this webinar to be very interactive and hope to get to as many of your questions as possible. Please type your questions in the questions pane of your GoToWebinar panel. And thank you to my colleague John, who is helping me to monitor the question stream today. Without further ado, I'd like to introduce our featured presenter, Dr. Abby Coodin. Dr. Abby is a 2010 graduate of the University of Minnesota's College of Veterinary Medicine. Since graduating, Dr. Abby founded Painted Sky Veterinary Services, a companion animal practice in Amory, Wisconsin. Although she primarily sees client-owned small animals, she also works with several dog and cat rescue organizations in Minnesota and Wisconsin. Dr. Abby also serves as a board member for the Alumni Association and Friends at the Veterinary College and participates as a mentor to students in both CFAN's undergraduate programs and the Veterinary College here at the university. Dr. Abby loves all aspects of veterinary medicine, but preventative health care is her passion. She believes that thoroughly educating pet parents about the pet health care is one of the most important aspects of keeping them healthy, and that's what she'll be talking about on today's webinar. Dr. Abby, welcome to the webinar.
Hi, thank you for inviting me actually to do this webinar. Very happy to be here today. And definitely talking about preventive care is definitely a passion of mine and very, very important for what we have to do for our veterinary friends and our veterinary patients. So without further ado, I think we'll give it a go. Do go ahead and submit any questions that you may have. We'll try to get to them as we're going here. And if I don't get to your question, you can feel free to contact me. There is a contact me information slide at the end of the webinar as well. So you can email your question to me and I'll be happy to get to you. So just kind of as an overview of the things that we're going to talk about today. So the first is going to be before you even get your pet. So if you're thinking about getting an animal, talking about the selection of that animal and what animal might suit your needs and your lifestyles best. The most important sort of comprehensive health things that we do for animals are probably going to be our physical examinations, when we actually have our senses on that animal and examining it for any abnormalities or any concerns that you may have while you're in that room with us and your pet. We'll talk a little bit about identification of animals through microchipping, tagging, that kind of thing. We'll also go over a heavy chunk about vaccinations and what vaccinations are recommended for all animals, what vaccinations aren't necessarily for all animals, and why that is. So we'll go over a big chunk about that. And other preventive care as well, including, deworming, if deworming is necessary for your animal, flea and tick prevention. So out in Amory, Wisconsin, We see a ton of tick-borne disease, and talking about going in to prevent that, very important. Heartworm prevention, why it is also more increasingly important than ever before as we're seeing a shift in populations of animals moving all over the country. We'll touch on some dental health tips as well as some blood work and just kind of a little bit on nutrition. So nutrition is a broad topic that could be talked about for hours on end on its own. So the first thing we talk about with selection of a pet is really why do you want that pet? Do you want it to just be your companion? Do you want it to be your couch potato companion? Or do you want it for more of a security issue? And what kind of a home do you live in? Do you live in a one-bedroom apartment? Do you live in a house with a fenced-in backyard? Do you have acreage that this animal can be running on? And the lifestyle that you lead. Obviously, if you're working, a 9-to-5 shift and you have a dog like an Australian Shepherd that's going to need lots and lots of activity to keep him happy and keep him normal, then that might not be the idealistic pet for you. And your activity level, are you an avid runner that's going to be going out and running 10 miles a day, or are you kind of a couch potato yourself? So all those are things to consider when you're talking about a breed or a particular animal, whether it be a cat or a dog or a small animal that's going to be right for you. We also recommend that you research the breed that you're considering carefully. So every breed has its own little quirks and things like that that we'd like you to consider, and we'll go over a little bit of that. And then costs associated with pet ownership. So many times we as veterinarians have owners that come into us that have their pet that has a specific problem that unfortunately they just never knew could be a problem for that pet, and they haven't had the money put away to address that problem. And as veterinarians, we never want to see that. We always want to see owners that can afford to treat their pets. And the most important one as veterinarians is to never, ever, ever give a pet as a gift. So a pet is not an item. They are a living thing. And you need to know that the person that you're giving it to can afford it, number one, and actually wants that animal. We see too many that are, Easter is a great example that just passed. We see too many bunnies that are given as gifts. They grow up and they don't want them anymore, so they send them to a shelter. So we don't want to see that. When talking about costs, there are things like maintenance costs. So obviously a Chihuahua is going to eat a heck of a lot less food than a Great Dane. A Great Dane is going to be going through 40 pounds of food in a week or less. So making sure that you have enough money set aside for food, collars and leashes, including vet visits. So you're talking about examinations, vaccines, blood work if it's necessary, routine surgeries like spays and neuters and dentals. The list goes on and on and on. And then is your pet predisposed to develop that genetic disease? So Cocker Spaniels, for instance, have a horrible otitis issues, so ear problem issues that they can be developed too. And they have horrible eye issues they can develop. Cavalier King Charles Spaniels, almost every single one that I've ever seen has developed a heart defect. They are very, very prone to heart disease. It's just kind of in their genetic makeup. And then Lab Retrievers. Labs, hip dysplasia is a huge one. So if you aren't prepared for these things to develop and to happen, then unfortunately it could be a costly thing if you haven't researched that. And then, of course, unforeseen costs. What is the average cost for an emergency visit? To walk in the door at most emergency hospitals, it's going to cost you between $150 to $200 just to have that emergency veterinarian evaluate your pet. That doesn't include any of the treatments that they're going to want to do. That doesn't cover any of the hospitalization costs that may have to be done, and that certainly doesn't play into any of the additional diagnostics that may be needed to be done, like x-rays and blood work and things like that. What is the average cost for a life-saving surgery? It could be anywhere from a few $100s to several $1,000s. So unfortunately, I had to give a client bad news just yesterday whose dog needs a respiratory surgery. And that surgery, the price tag for it in an ideal pet, which her pet is not, is about $2,500 to $3,000. So that's kind of just a thing to keep in mind. And as far as managing costs, there certainly are different pet insurance options, and pet insurance is something that we always encourage pet owners to do, especially before your pet has a problem, because once they have a problem, you run into the things that human insurance runs into, where if you have a pre-existing problem, they're not going to cover you. So definitely better to get on an insurance plan when they're young. And there's a couple different pet insurance companies that we work with. So VPI and Trupanion are pet insurance, but PetAssure is actually a really good one for owners to check out. I encourage you all to check it out. If your veterinarian is enrolled in it, it actually entitles you to up to 25% off most items just going in every single time. You don't really even have to sign up other than putting in your animal's name and information. So that one is a really good one to kind of check out. And then all the available credit options, some of you may have heard of Care Credit. It works just like a credit card. The advantage to that is it does have some finance-only options to be able to, for you to spread out payments over a certain period of time without any finance charges, essentially. Moving on to the physical examination that we have. These are recommended either annually or biannually. It really kind of depends on the age of your animal, if your animal has any previous sicknesses that it's been diagnosed with, because animals age much more quickly than humans. So your average pet is aging 7 years for every year, calendar year, that we have. And then most will do a head-to-tail approach. So you may see us start off with the face and move on down to the back to the tail, but some veterinarians also use a systems approach where they go for the eyes and the ears and then the gastrointestinal system and the respiratory system and the musculoskeletal system. It really depends on how the veterinarian has been trained and what their approach is and they're most comfortable with. A physical examination really gives us a tool to catch disease early. So some of the examples that we have are cancer. So that lump that you've noticed for like that last month that just kind of popped up, should we be aspirating that to look and see if it actually is going to be a problem? Chronic kidney disease, or CKD, that's one of the big ones that we pick up in cats. So cats don't usually show signs of chronic kidney disease until they are way far advanced into that kidney disease. Thyroid disease. So, for instance, a cat that's losing weight chronically but just seems ravenous, his appetite is ravenous. That's another one that we see all the time. And then periodontal disease, by far probably the most underdiagnosed disease that we see, but has huge impacts on the health of a patient further on down in their life. So what are we doing when we actually have our hands on your pet? So besides talking to you, because we certainly don't want to make an empty room, you know, with us, with your pet, an awkward situation where we're just standing there not saying anything to you while we're kind of handsy with your pet. So when we're looking at their eyes, we're looking at things for like cataracts. Do they have scarring on their eyes that is indicative of problems that may need surgical correction? Is there inflammation in their eyes that maybe you just haven't noticed because it's not severe enough yet? When we're looking at their ears, we're looking for otitis. There's also times that's just inflammation of the ear canal. There's also times when we pick up masses or polyps or inner ear infections inside the ears that we wouldn't see otherwise if we weren't using our otoscope to go down there and actually look. In cats, we think about ear mites, so picking up those, and wounds. So if an animal's been shaking its head excessively or scratching its ears excessively, they may have wounds in those ears that need to be addressed. When we're looking in their mouth, we're looking at periodontal health, so bad teeth or stomatitis, which is just inflammation of that mouth. We'll talk about a case of stomatitis when we talk about one of the vaccinations and one of the diseases that cats can get later on, and you'll see some pretty nasty examples of some stomatitis. And then oral masses. Is there something in there that we need to address because it may need to be removed? When we're looking at lymph nodes, we also do palpate lymph nodes. So we're looking for inflammation. There's definitely inflammation that can cause those to be bigger, but there's also cancerous processes that can cause those to be larger as well. So definitely looking at those. And when we're taking a look at the skin, we're looking from anything from just scaling, wounds, external parasites like mange, fleas, ticks, all of those things that we're looking for, and just tumors like we talked about before. When we assault the heart and the lungs, we're looking for murmurs or arrhythmias in the heart. Breathing problems, like the dog that I talked to you about that I saw yesterday, definitely has breathing problems that need to be addressed. So looking and seeing if that's an infectious cause, if it's an inflammatory cause. In this case, it's a physical cause, so the dog needs to have something physically done to it to have that surgical problem corrected. And then the abdomen. So we're looking for organ changes or things that just shouldn't be in the abdomen. So is there something that we're feeling inside, like a mass, that shouldn't be in the location we're feeling it in? Or does that liver feel like it's bigger than it should? Or that kidney feel smaller than it should? So we talked about cats and chronic kidney disease. One of the biggest things that we feel is that that kidney is shrunken and shriveled, where it should just be a nice kidney bean shape. Sometimes we'll feel that kidney be very shriveled in size. Any questions at this point on that? So I have a question about recommending that dog owners participate in classes that help their dogs relax. Absolutely. If you feel like your dog is one that is extremely anxious when they go to the veterinarian, definitely doing classes to help them relax during vet exams and grooming care is a good idea. Most veterinarians are also, at our practice, we readily encourage you to bring your animal in and pop them on the scale. Come in and see us. We'll feed your dog a handful of treats, pet them, love them, and do all that thing so they don't associate us all the time with being bad because we're doing things to them. They associate with, hey, I'm going to the vet clinic to get some treats. So that can relax them a ton. So we've seen several very, very anxious dogs, a few that I haven't even been able to touch, really relax when they've come in to see me for things other than getting vaccines or doing an exam. So yeah, definitely is recommended. I do really encourage proactive husbandry training. So yes. Getting back to the slides here, identification, so that can be in many different ways. So you can do tags. The problem with tags, even rabies tags, is that sometimes they can get lost. So that's the biggest thing. We see lost animals all the time, strays that come in to the Humane Society and they don't have any identification on them whatsoever. So this is where we recommend potentially microchipping your pet. So a microchip, as you can see down in the left-hand corner of the screen there, that is an actual microchip that gets implanted into the animal. It is a little bit bigger than a grain of rice, goes right between the shoulder blades. It has a unique identification number on it. So when they are taken into a shelter or a vet clinic, they are scanned. Most every single shelter that you go to and most every single vet clinic that you go to has a universal scanner, so it doesn't matter what kind of a microchip your animal has. They will usually pick it up. And then that identification number tells us which company actually has made that microchip, and then we can contact that company and we can figure out who that dog belongs to or that dog or cat belongs to. The problem is that some owners don't update their information with the company when they move. So you do have to remember that when you get a microchip, if you move, you need to call that company and update them with your current information so that they can continue to get a hold of you. Moving into vaccinations here, this is going to be kind of what we talk about the most, I think. So there are what we deem to be core versus non-core. And the core versus non-core was set together by the American Veterinary Medical Association, so that is their recommendations. That's kind of who all of us veterinarians listen to as our conglomerate for veterinary recommendations. So core are vaccinations that all animals should receive at recommended intervals. So, and these are often ones that are going to be serious and or fatal disease. So we're talking in dogs and cats about rabies and distemper. So distemper is kind of differently abbreviated, whether it's a cat distemper or a dog distemper. So you'll see on dogs it's DA2PP, and in cats it's FVRCP. So it's a distemper vaccine, but it's also a combination vaccine. So it's not just one disease that we're covering here. It's actually, in the dogs, we're covering 4. So not only are we're covering distemper, we're covering adenovirus, we're covering parvovirus, and we're covering parainfluenza virus. And we'll talk more about the viruses as we get into it. In cats, we have the feline rhino that we're doing, Calicivirus, and Panleukopenia is all in there. So it's a combination. So those are the cores. The non-cores are vaccines that aren't necessary for everybody. It is determined based upon that animal's risk assessment. So are you in an area that's prevalent for that disease, or is your animal in a situation, like for instance for kennel cough, Bordetella, in a situation where they're going to be around a bunch of potentially naive dogs? Do they go to a dog park? Do they go to a kennel? Those are the situations in which we would recommend Bordetella. If your animal is a couch potato at home and doesn't really go anywhere, then Bordetella probably isn't necessary for your pet. So with the rabies virus, everybody's pretty familiar with rabies virus because it's a big deal. So it actually affects the brain and the spinal cord of all mammals. So any mammal is susceptible to it. And it's what we consider to be zoonotic. And whenever I refer to zoonosis, it means that you can get it from an animal. So a zoonotic disease is something that you can contract from an animal. Its transmission is usually through infected saliva coming into contact with another animal's bodily secretions, more commonly associated with a bite of some sort. So the biggest carriers of this in Minnesota and in Wisconsin are going to be skunks, bats, and animals, so like dogs and things like that. But skunks and bats are the big ones by far. So usually people get worried if like a squirrel bites. Squirrels don't usually have rabies, so unless the squirrel is acting oddly, there probably isn't a whole lot of concern for it, but skunks and squirrels and raccoons carry quite a bit of it as well. So definitely the big two are skunks and bats. The symptoms can be anywhere from behavioral changes in vocalization to paralysis, seizure, and death. So most commonly, I think people associate rabies with drooling, which they can do, that foaming at the mouth, and that aggressiveness. Not always is rabies aggression. So sometimes we differentiate between the furious, what we call the furious, the aggressive state, versus the paralytic form. So just because an animal is kind of paralyzed on the side of the road, you probably shouldn't be going up and touching it because it very well could have rabies. So they aren't always in this aggressive, nasty state. Unfortunately, to diagnose this, we have to actually test the brain matter. There is no diagnosis for this in live animals, and once you are starting to show clinical signs for it, this is 100% fatal. So this is a big deal. This is one when we have an animal come in that's bitten someone that is not vaccinated, it's a big deal. Usually the sheriff's office is involved, the county is involved, the city is involved, we're involved. It's a really big deal. So these are kind of pictures of what a normal rabies virus would look like. So the one on the upper hand left would be that furious form, what most people kind of associate with rabies. But down on the right-hand side there is one that's very common as well. So it can just be this dog that is paralyzed in a corner and can't move. And then we have a cat here that's doing that drooling and that foaming at the mouth that most people also kind of classically associate there. As far as distemper virus goes, that's one of the other core vaccines that we see. This one is also extremely contagious, and we talk about it being a systemic infection. And whenever you're talking about something being systemic, it means it goes inside the body and affects the body system. And usually this is going to be aerosolized. So it's aerosolized into the air and other dogs breathe it in. And this one's going to be anything from just a fever, and then we get this nasty, horrid nasal and ocular discharge. And then these dogs just kind of go downhill. Puppies that are affected with this, It's usually a 60 to 75% chance that a puppy is not going to survive an infection with distemper. And so that's why distemper is so widely recommended as soon as that puppy turns 6 weeks of age. So there can also be gastrointestinal signs. Again, when we're talking about diagnosis, you'll find as we go through these slides that there aren't a lot of consistently great tests that we can do for these diseases. Most of it is just consistent presentation of clinical signs. So there aren't these diagnostic tests that we have sitting in our laboratory going, yes, this is distemper, yes, this is parainfluenza, yes, this is parvo, yes, this is this. We very rarely are we in that case where we can say, yes, definitively, this is what it is. And the treatment is very symptomatic and supportive. There's no cure-all, and we're going to find that that's going to be a very common theme too. There's not a lot of viruses, viral diseases, that there's a single golden bullet that will go ahead and treat these. And the neurologic disease, once they get neurologic signs, it is very often fatal as well. So this is kind of an example of what your distemper viruses might look like. So this is nasty ocular and nasal discharge that we see on these animals. The one especially in the upper right-hand corner, you'll see that has that nasty pus-like discharge coming from its nose. That's going to be the common things that we see for distemper. Adenovirus 1 and adenovirus 2. So you may remember when we talked about core vaccines, I said that distemper was DA2 PP, and there's a reason. It's because we actually only vaccinate now for adenovirus type 2 and not adenovirus type 1. And the reason that we do that is because we've researched and we found that when we do vaccinate for adenovirus 2, it is cross-protective for adenovirus type 1, and that the adenovirus type 1 vaccine that we did have actually had quite a few side effects, and so we've gone with something a little bit better. So the type 1 typically causes like liver inflammation and infection, and the type 2 is one of the causes of infectious tracheobronchitis. So there's kind of a triad of things that cause infectious tracheobronchitis, Bordetella being one of them, and adenotype 2 being one of them. So we'll talk about those. And these guys are just going to be mostly respiratory, this nasty, honky cough that just will not go away. Again, no real good test and no real good treatment. Most of it is just kind of supportive. Parvovirus. So parvovirus is another component of this core vaccine that we stress so much, especially in nice urban areas like Minneapolis. Parvovirus is so prevalent because people just do not vaccinate their puppies. And we cannot stress enough, vaccinate your puppy. This virus is so contagious. You can get it through any contact of any infected animal secretions whatsoever. You also see fomites down here. So fomites is any inanimate object that can carry disease. It can be anything from boots to gloves to a sidewalk to dirt. It can be anything. Any inanimate object that can carry something like that bodily secretion that can go in and carry that. So these puppies are usually extremely sick, and dogs are extremely sick. They have severe vomiting, this loss of appetite, severe foul-smelling, bloody diarrhea, and severe dehydration. These dogs are not doing well when they come in, and most veterinarians can tell you by looking at the animal and by smelling the animal. Most veterinarians can tell you, yeah, there's a good possibility that this dog has parvo just based on the smell and the appearance of the animal, because it does have a nasty, that diarrhea has a very classic smell. This one we actually do have a test for. It's a little snap test that we can do. And the treatment for this one, again, no golden bullet. It's just supportive and symptomatic. And usually these dogs, again, you know, once they get it, if they're in dire straits already with dehydration, you're looking at a 50-50 shot whether this animal is actually going to be able to pull through. So looking into the questions. So understanding the importance of vaccinating puppies and new adults. Why is it necessary to revaccinate every 2 or 3 years? Okay, so that is a very good question on vaccination. So with the research that we've done and with the research that these vaccine companies have done, that is the longest that they have been shown to be protected when we have done studies, basically challenge studies. So they've taken these animals, they've vaccinated them over a period of years, and they've waited those recommended intervals, whether it be 2 years or 3 years, and then they've re-challenged them with active virus to see if they can get these animals to show clinical signs of disease. And so what we have found is that most of these, once that 2 to 3 year period is up, that these dogs can actively be susceptible to developing these diseases. And the cases of distemper and parvo and rabies, for sure, when you're talking about these diseases being as fatal as they are, it is just recommended to get those animals protected. Not saying that all animals, once you hit that 3-year mark, their immunity runs out, because that's not how immune systems work. But it has been shown in studies that once we have that 2 to 3 year lapse in between, they need something to bring their immunity level back up, because they could be susceptible to developing it. So in this one, another question, your cat is a house cat, so no other animals around, it doesn't go outside. Why should you continue to get a rabies shot for him? And the issue of over-vaccination. So with that, the rabies vaccination is, unfortunately, because rabies is so fatal and because rabies is such a problem and is such a risk for public health, that's the reason why it is federally mandated. So it's not in our veterinarian power to tell you that you have to get vaccination. It's actually federal law. And federal law does that to protect the public, so that if, by chance, your animal ever were to get outside and be exposed, he or she would be protected. So, and that's because of the nature of rabies, because rabies is so fatal, and because of the nature of the disease. And then we have a question about potentially using titers to determine if a vaccine is needed. Unfortunately, we don't have enough information and research that has been done on determining what level of a titer is actually deemed protective. So not saying that there haven't been any studies that have been done, but there have been several studies that have been done that have shown that there may be certain levels that are indicative of protection, but that we haven't pinpointed exactly what exact specific titer level is considered protective yet. I hope that we can get there one day, because I do believe that over-vaccination is a problem and that it's getting to be problematic, especially as we see more people that don't adhere to manufacturing guidelines on how long vaccines actually last for, which I think everyone should kind of do that. If the vaccination manufacturer says it, is protective for 3 years, let's go with that. Let's do that recommendation, because it is they've done the research to do that. So I'm hoping that with further research we'll be able to get there eventually. So, and then I hear another question here about the last time my dog was vaccinated, he got sick, so vomiting and lethargy. Is there any way to prevent this? Yes. So speak to your veterinarian about that problem, and then they usually will put an alert on your chart that said that your dog has had a vaccination reaction. And I don't know if your dog got vaccinated with several vaccines or just that one vaccine, but sometimes we can pinpoint it to a certain vaccine, whether it be the rabies vaccine or the distemper vaccine or the Lyme vaccine, and they will pre-treat your animal, have you pre-treat your animal approximately 30 to 45 minutes before they come in for vaccines, and then that shouldn't happen in the future. All right, so moving on, we talked a little bit about parvo, so we'll advance here. So this is what your typical parvo case is going to look like, and I apologize for the graphic nature of the pictures. So you're going to have this nastily depressed dog, and unfortunately next to him is going to be like this very gelatinous, watery pile of diarrhea. And in the upper picture, you see that that's a very bloody case of diarrhea. And unfortunately, this dog also has roundworms. So you can see those spaghetti-type things sticking out of the diarrhea there. Those are also roundworms. So this dog has several problems going on once. And I had spoken about the ELISA test. That's that SNAP test that we can use to diagnose parvo. That is actually an example of what a SNAP test looks like and what an example of a positive test looks up for. So we actually put some fecal material on the little circle at the top, and we let that test sit for a little while. And once that test comes back, we can determine, yes, this animal has parvo, or no, if we're looking for something else. Parainfluenza, it's one of that triad of that infectious tracheobronchitis. So this one is very commonly mistaken for kennel cough. Much the same clinical signs, this nasty coughing, fever, sometimes nasal discharge, sometimes lethargy. They can often get pneumonia with this one. So this one is one that can definitely progress. And this one actually has antiviral drugs that we can treat it with. However, the antiviral drugs are extremely expensive. So most often these dogs are just treated symptomatically. Bordetella is that final component of that triad. So the one this is kennel cough. So usually this one is in dogs we talk about, but cats can also get Bordetella as well, and it actually does cross species. So a cat can give it to a dog, and a dog can give it to a cat. So that's one that we don't often see in veterinary medicine where it crosses species, but in this case it actually can. So we're talking about direct contact of the animals, but also through respiratory secretions, and again, those inanimate objects. And just again, clinical signs, supportive and symptomatic treatment is pretty much all we can do for these guys. Moving on a little bit to a tick-borne disease rather than a viral one. This one is caused by a spirochete, and there's an electron micrograph showing you what a spirochete looks like, which is basically a spiral, which is why it's called a spirochete. It's a bacterium called Bordetella burgdorferi, and usually it's a deer tick that's going to be carrying this guy. And there's an example photo there of a adult deer tick, and then one that's actually had a blood meal and is fairly engorged. So these guys can be anywhere from asymptomatic to sometimes I've seen these dogs come in where they cannot use their hind legs at all, and that really can cause some terror in an animal owner, that their dog was fine the night before and then all of a sudden, boom, came back and they can't use any of their legs. They're just laying there. The more common symptoms we see are just not wanting to do anything, not wanting to eat, fever, and occasionally in this one, about 1 in every 10,000 dogs, and we don't know why exactly it is, but that can go right to the kidneys and cause acute renal failure. So it's always recommended that these dogs' kidneys get evaluated when they have this positive diagnosis for Lyme disease to make sure that that hasn't happened. There are ELISA tests and titer tests that we can do for this. And this one we have a little bit more information on the titering of this disease and whether or not a titer means an active infection or a non-active infection. So depending on what a titer comes back as, we may say, yes, we need to treat your dog because it has an active infection, or no, we don't need to treat your dog at this time because it's just an infection that the dog has had around for some time and isn't responding to. And the treatment for it is tetracycline antibiotics, and other supportive care. Maybe if they're having issues with lameness because their joints hurt, we may put them on some sort of a NSAID or something to make them feel a little bit better there. Leptospirosis. This one is also a spirochete bacteria. This one is zoonotic. Again, zoonosis, meaning you can get it. So there's 4 different strains that we actually see in the dog. There's Canicola, Pomona, Grippotyphosa, and Icterohemorrhagica are the big ones. So this one is through urine contamination. Usually we're talking about stagnant water sources that wildlife are able to urinate in. So ponds, small lakes, soil that's near these ponds or small lakes is the big transmission for this one. So symptoms can be anywhere from mild to severe. So these guys, when it gets severe, this actually goes in and attacks the liver and causes severe inflammation of the liver and causes problems because your liver takes care of your coagulation issues, it causes severe coagulation problems as well. So the diagnosis on this one, there's no silver bullet really unless you're seeing those spirochetes in the urine, but it's very symptomatic and supportive for this. So this is what those dogs are going to be looking like. So again, that spirochete bacteria. This is a dog that unfortunately did not make it, and again, I'm sorry for the graphic nature of the picture, but this animal is extremely jaundiced. You can see that it's yellow, and not only is it yellow, it's yellow everywhere. So its belly is yellow, its mouth is yellow, its paw pads are yellow, and when we went in and did necropsy on this animal, you can see that the liver, which normally should be this nice dark red color that you see at the top of the picture, is also nasty and yellow. So it just goes in and destroys the liver, unfortunately. Coronavirus. So corona is intestinal disease. So transmission is usually exposure to those infected feces. So anywhere from mild to vomiting, explosive diarrhea. In severe cases, this one can mimic parvo. There's kind of a disconnect as to whether owners or whether veterinarians actually vaccinate for this one or not. And the reason for that is that, again, our treatment for it is supportive and symptomatic care. There isn't a golden bullet diagnosis for this, so I don't know that any veterinarian can say, yes, I've 100% seen a case of coronavirus and I knew how to treat it, because this one looks so much like parvo and looks so much like some other gastrointestinal issues that animals get that I don't know that we really can say that it is coronavirus 100% that's causing this problem in animals. So some veterinarians recommend giving it while they're a puppy and then never again. Some vaccinate for it all the time and some never vaccinate for it at all. It really depends on the veterinarian. Moving into the kitties, so rhinotracheitis. So this one is a herpes virus type infection. Herpes very different in animals than it is in people. So this one is a major cause of upper respiratory disease in cats. So can cause issues with the eyes as well. So we see a lot of kitties that have herpes virus infections that constantly have eye issues. Nasty draining eyes, problems getting ulcers in their eyes. Again, clinical signs and supportive and symptomatic therapy. Antiviral ophthalmic drops, again, extremely expensive. They're going to cost you about $100 a pop, and it's a very small bottle. There is some literature out there to suggest that the amino acid L-lysine, when given to cats on a chronic basis, will actually help them from recrudescing and showing clinical symptoms of herpes virus. So some owners do give L-lysine. So our research has shown that sometimes, yes, it helps, and sometimes, no, it doesn't. So I think the jury is kind of still out on whether it really does or it doesn't help at this point. So this is what we're going to see when we see rhinotracheitis. So these cats that come in that have this nasty, horrid discharge coming from the eyes and the nose, and in some cases have third eyelids up covering the ear, covering the eyes completely. Calicivirus. So this is the one that I said in the beginning we'd come back to stomatitis, inflammation of the mouth. So this one cannot just be respiratory, but it also can be oral disease as well. So, and usually what we're going to see is these nasty ulcerated structures inside the oral cavity. So these cats are going to come in because they're drooling and because they're not wanting to eat and because they're in a lot of pain. So we can actually definitively diagnose this one, although it is expensive, but there's not a whole lot of definitive stuff we can do for it outside of just supportive and symptomatic care. So these, again, pretty graphic pictures. So pretty horrible respiratory disease, but the big one that we worry about is this stomatitis. So you can see in the cat on the upper left here, those gingiva are just ulcerated. There's no gingiva, healthy gingiva on the margins where the teeth connect to the gingiva there, and you can see on the tip of the tongue underneath, that is just completely ulcerated off. So these cats are in a ton of pain. On the bottom left picture there, you can see that that tongue is ulcerated. So in these cats, typically when we sedate them and we open up their mouths, we can actually just kind of grab that top piece of tissue and it just peels away. It's sad to see cats that actually have this disease. But that distemper vaccine, that FVRCP, actually covers for this. So if you get your cat vaccinated, we can hopefully prevent this kind of thing from happening. Panleukopenia. So this one is the one that's also known as feline distemper. It's also known as infectious enteritis, and it's also known as the parvovirus for kitties. So very mimicking to the parvovirus for dogs. So infected secretions and excretions, that's also passed in the feces. So this one can be just sudden death. You walk in and you find the cat on the floor, unfortunately. They can get that vomiting and the diarrhea. They can also get septic shock. This one is very responsible for a condition we call fading kitten syndrome. So a kitten seems very healthy, and then all of a sudden they don't seem so healthy, and then they just kind of go downhill, and eventually they pass. So usually this one is marked with clinical signs with history of no vaccinations whatsoever. So again, we have to be pretty aggressive with these guys. So graphic pictures again. So the kitten on the left, that would be a fading kitten. So you can see how recessed those cats' eyes are inside the orbit area. So this cat is extremely, extremely dehydrated and very, very, very sick. So that's probably a kitten that's not going to make it, unfortunately. Leukemia, a big one that we have, so it's a retrovirus like HIV. It works a lot like HIV in its transmission, and it works a lot in how it operates. So it decreases the body's immune system response, meaning that a cat will not eventually die of leukemia. They will eventually die of something that they've contracted because their immune system is susceptible from leukemia. So they usually will be asymptomatic over a period of time, but then eventually will just show an overall decline in health. We do have testing for this one, so we recommend testing all kittens for this actually, and in some cases if a kitten shows up positive, we recommend retesting them in 6 months because there are certain cats that can actually, as kittens, kick this disease. So there are ones that can. There's also a myth out there that feline leukemia has to be through a bite. So that is not the case. Feline leukemia can be spread just between casual contact between cats. So if your cat goes outside, even in like a kitty condo or something like that, it's recommended that your cat get feline leukemia because another cat that could come into your yard could have leukemia, come up and just have a casual nose-to-nose encounter, and boom, your cat gets feline leukemia. So there is no cure for this one again. So this is typically what we're going to see eventually. We may see some pale mucous membranes over a period of time, but we're also just going to see on the left here this cat that just has lost weight and has gotten kind of emaciated over time. It's kind of what we see for leukemia. FIV, so FIV, feline immunodeficiency virus, very similar to feline leukemia in that they can be asymptomatic and in that they won't eventually die from immunodeficiency virus. They will die from something secondary to their body not being able to immunologically respond because they have FIV. So this one can be also definitively diagnosed, but again, there's no real cure for it at all. This one is the one that is definitely transmitted via bite. It also has to be transmitted through birth or through the milk, so an infected mom nursing her kitten. So you actually have to have a bite for this one to go, not just that casual contact. Moving on a little bit from vaccinations now, we're moving into other preventive health care, so things that we recommend. We recommend doing fecal examinations on animals. It is estimated that up to approximately 33% of animals have intestinal parasites that owners don't know about. And so we do recommend at every annual examination a fecal sample be brought in from one or more of the animals in the house so that they can be treated if necessary. Common parasites that we see are rounds and hooks and tapes and coccidian whipworms, and then we see a protozoan and giardia. So the consequences of parasitism can be many. So it can be anything from just they're just not growing right. In puppies, we talk about this little potbelly abdomen appearance that they get. They can just be thin and be ravenous. They can be poor hair coat in cases of hookworm infection because hookworms attach to the mucosal lining of the intestines and suck blood. We can have anemia, which is that low red blood cell count. They can get diarrhea, vomiting, and coughing, and in cases of extreme parasitism, it can actually cause death of an animal. So kind of a picture of what we're looking at for hookworms. So hookworms and roundworms are both considered zoonotic, meaning animals can give them to you. And basically, hookworms are cutaneous larval migrans, meaning that if you step in, for instance, like this person unfortunately had the good fortune to. If you step in a larva of a migran, it will, or a larva of a hookworm, it will eventually hatch and burrow underneath your skin and start forming all of these little trails while it burrows through your skin. In roundworms, it's called a visceral larval migran, visceral meaning not in the skin but actually in the organs. So this one will actually get into the organs, and you can see in this case a roundworm has actually gotten into the eye, and they can actually be undetected in there and cause blindness eventually. So recommended that if you have, litter, sandboxes and things, this is the reason why we say cover them, because if you have a kitty cat going out and using it as a litter box, because cats like big litter boxes, definitely recommended to cover it for this reason. So these are two of the big ones that your people can get. Tapeworms and coccidia, these are just kind of pictures of these guys. So tapeworms, we liken everything to food. So tapeworms kind of usually, if you're seeing them on the backside of your animal, they're going to look like little grains of rice, but that's actually what a tapeworm looks like when it's full-on adult. And coccidia, usually we'll only see them underneath the microscope, so that's why we recommend doing that fecal examination. And then whipworms, again, we'll usually see them only under the microscope as well. And then Giardia, we can see two different forms of it. We can either see a cystic form, which is at the bottom there, or we can see the trophozoite form of it, which kind of looks like little Medusa hanging out there, under the microscope too, if it's fresh enough. So this is one that definitely can cause issues with vomiting and diarrhea. So all of these guys can. Other preventive things, definitely ticks. We talk about the spread of Lyme and anaplasmosis and Ehrlichia and Rocky Mountain spotted fever. As Rocky Mountain spotted fever is starting to come across state lines and move closer and closer and closer to us. Fleas, we talk about not only are they bothersome, but they can get on you, and then they're bothersome to you, and you pretty much have to wage chemical warfare in your house to get rid of them. We have animals that do actually have a condition called flea bite hypersensitivity, where they are actually allergic to the saliva of a flea, and even one flea can cause these animals to rip themselves to shreds. So in those cases, it is very prudent to have your animal on something that's going to keep them from getting an infestation with fleas. And then mites, there are several different kinds. There are the ear mites that we talked about earlier, but there are also several that can hang out on the skin as well. So just a few examples of what some deer ticks and dog ticks and things look like when they're engorged and when they're not. So you can see from the ones that are on that dime head there, they can be extremely little in that you would never even see them on your animal when they're in that teeny tiny little nymph stage. You're not even going to see them on your animal. And then fleas and mites, so that's some examples of them when they're actually under the microscope there. So those are the guys that we see. Demodex and Sarcoptes can be really bad for animals to have. They cause extreme itching. In most cases, these animals are pulling their hair out. They're causing wounds on themselves. In Sarcoptes is also zoonotic, meaning that you can get it. So if you're itchy and your dog is itchy, you and your dog both need to go see a doctor. Heartworm disease. So heartworm is one that we harp on a lot, but a lot of pet owners unfortunately don't take us seriously. Heartworm is becoming a lot more of a problem up here in the upper states. It is epidemic down in states like Florida because their mosquito season is just plain longer. But what people don't realize is that as our pets are becoming more of our family, we are actually moving them across country more than we ever have before. So our pets are going on vacation with us, which leaves them susceptible to diseases that we wouldn't find necessarily as prominently here, but we do find in those areas where they go and they do vacation at. The other thing that's happening is that animal shelters, for instance, or rescue organizations, for instance, are going down into states and bringing animals that were southern animals back up into the northern states, and these animals are then residing up here that may potentially have been exposed to these diseases. So in practice so far, I've already seen 2 heartworm positive dogs, and that's out in Wisconsin. So they are here, and heartworm is definitely here, and it is definitely recommended because of the treatment that they have to go through to treat this, that in some cases dogs don't survive from the treatment, that prevention is key here, and that we do the prevention that is necessary. Quickly, a little bit on dental health. So dogs and cats, contrary to popular belief, again, they rarely will ever show you concrete signs of dental pain. So the biggest one that I see is the dog that comes in and has a canine that's cracked off almost to the gum line. That dog is painful, but you just might not be seeing concrete evidence of pain. So that dog may, when that tooth is removed, the clinical signs you're going to see is that that dog is going to be more ravenous probably than it ever has before. So there's definitely a need to intervene before teeth are cracked to that degree even. So poor dental health also is not just doesn't just cause bad breath, but it also has links to cardiovascular disease, so it can affect their heart, it can affect their kidneys, and it can cause liver disease later on. If they have bad enough teeth, it can also cause bone loss and fractures in the face, which can be detrimental to these dogs over time. So running through the grades, basically dental health is graded from grade 1 through 2. So grade 1, we have a little bit of buildup, a little bit of inflammation, but it's grade 2 where we start seeing those attachment losses and things like that. And then at grade 3 is when those teeth really start to become loose, and grade 4 is when they're pretty much fallen out. So this is kind of a chart going through dental disease, so all the way from grade 1 to grade 2, or to grade 4, and basically we want to intervene when they're at just grade 1. Anything beyond grade 3 is not going to be reversible, so those teeth are going to have to be managed, but the loss that's there, the bone loss that's there, the gingival margin loss that's there, none of that is going to be reversible. At stage 2, we can still intervene and reduce a lot of it and reverse a lot of what's going on, but at stage 3, unfortunately, too much damage has been done at that point. Blood work, touching through that just quickly, it's definitely recommended before any surgery that your animal goes under to get the status of your pet's health before anesthesia. We also really recommend having it done when your animal turns into be a senior animal, which at most animals is right around 6 or 7 years of age, to make sure that even if it's not abnormal, we have a very normal baseline to go off of should your animal ever become ill. So there's nothing worse than having an animal become ill. We do blood work and we go, well, that's elevated, but was it elevated before? Well, we don't really know. So is it causing clinical symptoms? Is it not causing clinical symptoms? Where if we had baseline blood work, maybe we would know. Is this an ongoing problem that's gotten worse? Or is this a problem that may be already present and may not be causing what's actually going on here? It also is, if it's abnormal, it might be the first sign for us to intervene. And in illness, it definitely gives us a good clue as to what's going on. The two aspects of it are a complete blood count and a chemistry panel. So the complete blood count gives us the major cell types in the blood, red blood cells, white blood cells, tells us if there is infection, inflammation, anemia, some types of cancer, where the chemistry panel looks at the actual organ systems that are there, the kidney, the liver, as well as, endocrine disease, Cushing's disease, thyroid disease. Those are the big things that we're going to be picking up with blood work. So that is all that I have for my presentation there. If you guys have any questions, I see a question here. So Bordetella and or tracheobronchitis often undetected or hard to diagnose. Passed away thousands of dollars at the university. It can be, yes. So it's one that does not have a diagnosis per se. So it's very well could have been. Another question, giving 8-year-old mutt glucosamine chondroitin is preventive. Glucosamine and chondroitin is definitely recommended. It's one of those hot button issues with veterinarians with us. So vitamins, You know, vitamins are kind of a mixed bag depending on which vitamin you're talking about, but glucosamine and chondroitin and vitamins in general, it brings up the situation with nutraceuticals. And nutraceuticals, as most people aren't aware, are not as rigorously scrutinized as your average medications. So nutraceuticals kind of fly under the radar. What does that mean for you? It means if I go pull 5 different manufacturers' brands of a certain vitamin off the table, and they all say they have however much vitamin in them, and I send them to 5 different laboratories, those are actually going to come back at all different levels. So you really have to be careful what kind of glucosamine and chondroitin you're giving your dog and make sure that it comes from a reputable source, because you could just actively be kind of throwing money down the drain. And one of the sources that I do recommend is Nutramax. So Nutramax makes a product called Cosequin and Dosequin. Those are the best glucosamine and chondroitins you can buy for your animal.
Dr. Abby, oh, sorry. I just was going to, I just put your contact information up here just if people have follow-up questions. I just have to, you know, we're approaching that 1 o'clock and I want to be respectful to people's time. So thank you so much for a fantastic webinar. And, and again, this is Dr. Abby's contact information. And if you have any follow-up questions, please don't hesitate to contact her. So in closing, we have one last webinar is coming up on Thursday, April 30th at noon, entitled It's Not Just Luck, Increasing Your Odds for Early Career Success. And you can sign up for this webinar at minnesotaalumni.org/alumni or /alumni webinar series. If you're on social media, be sure to connect with the University of Minnesota Alumni Association on Twitter, LinkedIn, or visit our home webpage to see all of our different channels. And in closing, members of the University of Minnesota Alumni Association make new initiatives like this webinar series possible. Thank you. Because of members, we can enrich the lives of alumni, support student success, and make a better University of Minnesota. Become a member today at minnesotaalumni.org/join. This is the conclusion of today's webinar. Thank you for joining us and being an active member in the worldwide community of the University of Minnesota alumni and friends. Have a wonderful day, and Ski Yuma.